skull via the jugular foramen in the suboccipital region. Some studies have indicated that the suboccipital decompression technique improves parasympathetic tone by increasing heart rate variability. In this technique, the patient lays supine. Gently lift the patient's head and let it rest in your palms as your finger pads support the weight of the head through their contact on the suboccipital region. Your finger pads should be inferior to the superior nuchal line, curling around the base of the occiput. You may assess here for tension and slowly and carefully, as the tissues allow, let your fingers sink further and further, letting muscular tension ease from outermost tissue to innermost, trapezius, then semispinalis capitis, and finally sinking all the way to the suboccipital muscles. As these muscular and fascial tissues begin to relax, the patient's head may drop further and further back into your hand. Relaxation may take anywhere from 30 seconds to a minute and a half. Assess for effect by reassessing the tissues after the treatment. The next technique is rib raising. Rib raising can be used to improve respiratory excursion as well as improve autonomic homeostasis via decreasing sympathetic tone. Its proposed mechanism is via release of the costotransverse articulation, as just anterior is the sympathetic chain ganglia arising from T1 to L2 and supplying sympathetic innervation everywhere in the body. Rib raising can be performed seated or supine. We'll first demonstrate it seated, with the patient in the seated position facing the doctor straddling the end of the exam table. This provides better stability for treatment. Place a pillow on your shoulder and have the patients place their arms resting on the pillow, turning the head away from you. Place your finger pads around the patient between the costotransverse articulation and the rib angle. A lunge stance provides extension for the patient's back as you gently distract the ribs from the costotransverse joint anteriorly and laterally. You may walk your contact up and down the ribs, releasing each area, moving in a rhythmic motion or holding the tension for a few seconds. In the seated position, the technique is done bilaterally simultaneously. This technique may also be done with the patient supine and the doctor seated. The fingertips contact the rib angles and gently lift anteriorly and distract laterally. The doctor achieves this motion by pushing down through their elbows, using the contact with the table as a fulcrum and generating an anterior force through their fingertips. In the supine position, the technique is done on one side and then the other. Hands-on treatment of the suboccipital and thoracic regions with these techniques help us better integrate a mind, body, spirit approach, optimize physiology, and improve homeostasis during stressful times in our patients' lives.